Hello and welcome to a quick summary of the MBRRACE 2020 report for the UK, and we look at the direct and indirect causes of maternal mortality. So the MBRRACE is a report to mothers and babies, reducing risk through audits and confidential inquiries across the UK. And this 2020 report looks at the triennium, so the 3 years between 2016 and 2018. Firstly, we need to get the definitions, okay? So according to the WHO, a maternal death is a death of a mother during pregnancy or up to 42 days, which is 6 weeks, after the end of the pregnancy. A maternal death is one that's caused for any cause related to or aggravated by pregnancy or its management, but not from accidental or incidental causes. Maternal death is divided into direct deaths and indirect deaths. So direct maternal deaths are obstetric complications of the pregnancy state from interventions, omissions, or incorrect treatment, or from a chain of events resulting from any of the above. So example of direct deaths would include preeclampsia, eclampsia, clots, PEs, amniotic fluid embolism, hemorrhage. So the next one is indirect deaths. So this is death of a mother due to pre-existing disease or a disease that develops during pregnancy, which was not due to direct obstetric causes, but which was aggravated or made worse by the physiological effects of pregnancy. So these include cardiac disease, neurological conditions, such as epilepsy, psychiatric causes, including drugs and alcohol. Lastly, a late maternal death is a death from 42 days to 1 year after the end of the pregnancy, and it is due to direct or indirect causes. From the MBRRACE 2020 report, the maternal mortality rate is 9.7 per 100,000. So what that means is 9.7 women died per 100,000 women during pregnancies or up to the 42 days after the end of the pregnancy. So looking at the 2020 report and the direct causes of deaths. Number 1 is thrombosis and thromboembolism, such as PE. And the joint second one is due to hemorrhage. That can be antepartum or postpartum hemorrhage. The other joint second cause is suicide, so psychiatric causes. The fourth leading cause of direct death include genitourinary sepsis. The fifth is early pregnancy deaths, such as like pregnancy, miscarriage, termination. Number 6 is from amniotic fluid embolism. 7 is due to preeclampsia or eclampsia. And lastly, 8 is anesthetic-related complications. Next, if we look at the indirect deaths, so these are deaths due to a disease that was pre-existing or ones that occurred during the pregnancy, but it's aggravated by the pregnancy. If we look at the top cause of indirect maternal deaths, it's due to cardiac disease. The second one is indirect neurological conditions, such as epilepsy. The third one is other indirect causes. Number 4 is psychiatric causes, such as drugs, alcohol, and others. Number 5 is indirect sepsis, such as pneumonia. Number 6 is indirect malignancies. And number 7 is indirect sepsis from influenza. So that's a quick summary of the direct and indirect causes of maternal mortality, according to the latest MBRRACE report published from 2020.